Hello and welcome. My name is Ana Daniela Pomohach. I'm an Aspen University student, and today I'm going to present the role of the nurse leader in preventing pressure injury. Objectives. By the end of the presentation, you will be able to describe the role of the nurse leader in preventing pressure injury, explain why root cause analysis is important in pressure injury prevention, explain why medical facilities must keep track of pressure injuries. Pressure injury incidents. Pressure injuries are injuries of the skin and underlying tissue over bony proeminence due to prolonged pressure or pressure combined with shear. Although most hospital-acquired pressure injuries are preventable, approximately 2.5 million individuals in the United States develop a pressure injury yearly in acute care facilities. Many of those who develop pressure injuries during their acute care episodes are elderly, malnourished, and remain hospitalized for longer periods of time. This pressure injury can result in extensive harm, including chronic wounds and as many as 60,000 deaths annually. Nurse leaders. The provision of guidance, direction, and resources to nurses and other medical professionals by nurse leaders is critical in minimizing the prevalence of pressure injuries. Nurse leaders are responsible for creating a culture that prioritizes safety, creating rules and operating procedures to limit the risk of pressure injuries, and ensuring that appropriate personnel and resources are available to give excellent medical care. By cultivating a culture of safety and offering direction on how to avoid pressure injuries, nurse leaders can set the tone for the overall effort to reduce the number of patients who sustain such injuries. The role of the nurse leader in preventing pressure injury. Implementing evidence-based practices. Nurse leaders ensure that their teams adhere to the most recent standards and best practices for preventing pressure injuries, such as regular patient repositioning, pressure relief devices, and correct skin care. Educating and training personnel. Nurse leaders ensure that their staff is well trained and informed on pressure injury prevention and management. They are responsible for informing their employees about the importance of pressure injury prevention and the right strategies to utilize. This includes continuous training and reinforcing optimal practices. Encourage interdisciplinary collaboration. Nurse leaders encourage collaboration among other healthcare experts, including physicians, physical therapists, and dietitians, to address the numerous factors that contribute to the development of pressure injuries. Monitoring and assessing outcomes. Nurse leaders collect and evaluate data on the incidence and prevalence of pressure injuries, using the knowledge to identify areas for improvement and change their strategies accordingly. The role of the nurse leaders in preventing pressure injury continued. Advocating for resources. Nurse leaders may campaign for more resources, such as specialized equipment or extra personnel, to help their team prevent pressure injuries. Fostering a culture of safety and quality. Nurse leaders foster an environment where employees feel empowered to speak out about potential hazards and are committed to providing high-quality care. Creating and enforcing evidence-based policies and procedures. Nurse leaders are responsible for developing and enforcing evidence-based policies and procedures that guide nursing staff in preventing and managing pressure injuries. Promoting a prevention culture. Nurse leaders cultivate a culture that highlights the importance of pressure injury prevention and encourages employees to be proactive in recognizing and assessing risk factors. Root cause analysis. Nurse leaders must answer these questions to identify the issue. What is the prevalence of pressure injury in the facility? How many pressure injuries are acquired in the facility? Where are the system failures? How is the staff doing with assessment, prevention, treatment, and documentation? What is the staff knowledge of the problem? What are the barriers to change? Prevalence includes everyone who is admitted. Incidence includes only those who receive a pressure injury while in the medical facility. For each pressure injury, the nurse leader has to ensure that a root cause analysis (RCA) is performed. The RCA aims to find out system-wide what happened, why it happened, and how to prevent it from happening again. This should be done for each pressure injury that develops in the facility to improve care. Possible problems identified in an RCA include knowledge issues, prevalence, incidence rate, practice, patient education, communication, and documentation. Root cause analysis continued. An RCA is a teaching opportunity and education should be provided for areas that need improvement. This is not an individual issue, but rather both a unit and facility issue. The nurse leader should look to change for the better and look at RCA results. She should identify where the unit or facility needs to change and come up with a plan of change. The hardest task is to sustain the change. The nurse leader should establish priorities and timelines and keep goals realistic. Prevalence and incidence. The nurse leader should investigate the factors that contribute to prevalence and incidence. This could be due to critical ill patients, the time of the year, catastrophic occurrence or staff turnovers, administration change, turmoil, and documentation changes. The nurse leader should ensure that all staff members understand how their unit is performing and how it compares to the rest of the facility. This information should be shared with the public by posting it or making it available when requested. If the number of incidents increases, all staff members should be notified. The nurse leader should ensure that this data is communicated through staff meetings and posts on the unit. Facility administration should also be aware of both unit and facility results. Nurse leader responsibilities. Additionally, the nurse leader should make sure unit staff appreciate the need for pressure injury prevention, know that it is ongoing, and understand their role in pressure injury prevention and how it relates to the roles of other staff members. Providing feedback on the effectiveness of pressure injury strategies and celebrating success is also important. Nurse leaders should designate enough unit champions, request needed supplies and equipment, fund required supplies, equipment, training and retraining, keep abreast of pressure injury prevention, promptly fill staff vacancy, and support electronic data collection. Conclusions. Creating a shared vision and fostering team spirit inside the unit helps create common interests and goals, eventually leading to inspiration, motivation, and accountability. The nursing team must rely on the nurse leader's managerial skills to set clear expectations while maintaining a challenging and successful approach. To address this nurse-sensitive indicator and improve performance, the chief nursing officer, CEO, nurse leader, and bedside nurse must all work together. References.